Good afternoon and welcome to this press conference with Minister Paddy Hajdu, Dr. Evan Adams, and Monsieur Patrick Boucher. We'll start with opening remarks and then we'll move on to a question period. Nous allons commencer avec quelques remarques d'ouverture, puis nous passerons à la période de questions. Minister?
Merci, Kwekwe. Hello, bonjour. Je m'adresse à vous aujourd'hui depuis le territoire non cédé et traditionnel du peuple algonquin. Je suis accompagné de Dr. Evan Adams, médecin en chef adjoint de santé publique, et de Patrick Boucher, sous-ministre adjoint principal de la Direction générale de la santé des Premières Nations et des Inuits, qui seront à mes côtés pour répondre aux questions après ma mise à jour sur la COVID-19 dans la communauté autochtone. But before we begin the update, I do want to just share my deep and profound sadness and grief as we learn of the 169 potential unmarked graves discovered on the site of St. Bernard School in Capoeino First Nation. This discovery is a powerful reminder of the devastation that colonization has wreaked on Indigenous peoples across the country and how much more we must all do and quickly to right these wrongs. The government remains committed to supporting families, survivors, and communities in commemorating those who were forcibly removed from their homes and who never made it back to their community, some who remain missing to this day. Officials from Indigenous Services Canada have been and will continue to be in close contact with Capoeino First Nation to offer supports and services that people identify and need in the communities and as they grieve together. Nous sommes déterminés à soutenir les familles, les survivants et les communautés dans la commémoration de ceux qui ont été arrachés de force à leur communauté et ne sont jamais retournés chez eux, certains étant toujours portés disparus à ces jours. Des fonctionnaires de service aux Autochtones Canada ont été et continueront d'être en contact étroit avec la Première Nation Capoeino afin d'offrir toute soutien supplémentaire nécessaire, tout en respectant les communautés et les familles pendant cette période de deuil. Also yesterday, Indigenous Services Canada and Jurist Power Law announced that we've reached a mutual agreement to put the litigation of Nicholas versus Canada on hold to pursue a legislative solution to end the ongoing effects of enfranchisement under the Indian Act. Enfranchisement measures were taken by the Canadian government to extinguish individual Indigenous rights. As I've said before, reconciliation will move more quickly the faster that we can agree on solutions that are outside of the courts. The government will work with First Nations, Métis, and Inuit partners to address inequities in the registration provisions in the Indian Act related to enfranchisement. The goal will be to ensure that family histories of enfranchisement no longer affect entitlement to registration under the Act. I'd also like to take a moment to share with you a great example of reforms underway to make healthcare systems across the country more aware and sensitive to Indigenous cultures. Sturgeon Lake First Nation, Saskatchewan is taking part in a pilot project funded by Indigenous Services Canada to bring to restore traditional Indigenous birthing practices. On Wednesday, a mother gave birth to a baby boy using traditional practices and welcomed in ceremony. The community participated in the event with elders, knowledge keepers, birth experts, midwives, and health professionals, all helping to bring the new life into the world. The story is indeed a hopeful one in these times that so many people are finding very difficult. And one of those difficult challenges is the ongoing battle with COVID-19, but there are bright spots there too. As of March 2nd, 2022, over 88% of individuals aged 12 and older in First Nations, Inuit, and territorial communities have received a second dose of an approved COVID-19 vaccine, and 27% have received a third booster shot. Over 50% of individuals aged 5 to 11 have received at least one dose. Every person that steps up to get vaccinated is protecting themselves from severe illness and death and saving their loved ones from the worry and grief and potential loss. On First Nations reserves, as of March 2nd, Indigenous Services Canada is aware of 86,866 confirmed positive COVID-19 cases overall. Of those, 2,975 are active. There's been 2,989 hospitalization, 83,227 recovered cases, and 664 deaths. For the week of February 24th to March 2nd, 2022, the average daily reported active case counts dropped by 10.7% compared to the daily average the week before. With regards to assistance from Canadian Rangers, the Canadian Armed Forces have approved and extended 5 requests for federal assistance in First Nations in Ontario. In each case, Rangers are providing COVID-19 mitigation support to the community. Firstly, a request by Casablanca Lake First Nation was approved on February 25th, and Canadian Rangers are providing support for 2 weeks until March 10th, with the possibility of a 2-week extension if needed. In Saskatchewan First Nation, a request for assistance was approved on February 1st, and a new request was approved to continue support until at least March 16th. In Mishkegowgaming First Nation, a request was approved on February 9th, and 2-week extension approved until March 11th. And in Abumatang First Nation, a RFA was approved on February 10th, and a 2-week extension approved until March 10th. And lastly, in Attawapiskat First Nation, a request was approved on February 16th, and on March 1st, a 2-week extension was approved until at least March 16th. Operation Remote Immunity 3.0 has now ended. This was an operation by Canadian Rangers to support provincial vaccination programs in remote Indigenous communities in Ontario. And a huge miigwech to the Rangers and all of the partners, because they coordinated nearly 200 vaccine clinics in 29 remote and isolated Indigenous communities served by the Sioux Lookout First Nations Health Authority and the Winnebago Area Health Authority. Approximately 9,700 doses of COVID-19 vaccines have been administered in remote communities since November 2021, and we're very, very grateful to the Canadian Armed Forces for their collaboration in this help. The RFA will remain active until March 31st, just in case there are unforeseen requirements for additional support. And lastly, Canadian Rangers have concluded providing COVID-19 mitigation support to Winusk First Nation in Ontario, and again, a huge thank you to the Canadian Armed Forces members that have been involved. Throughout this pandemic, Indigenous leaders have been at the forefront, working in extremely creative and different ways all across the country to keep communities safe and informed. Just recently, the Skonan First Nation, for example, purchased a 4-bedroom, ready-to-move trailer unit that can provide families who test positive for COVID-19 a safe place to rest and to isolate. Community leadership identified this need for family isolation options and bought this mobile unit with $250,000 in funding through the Indigenous Community Support Fund. And they're very confident that this facility will help reduce the spread of virus within households and the community. Indigenous Service Canada's regional offices and regional medical officers of health will continue to be working closely with First Nations, Inuit, and Métis communities as they manage COVID-19. The department can offer a range of services and support, including temporary infrastructure, rapid testing, or personal protective equipment. As our COVID-19 situation continues to evolve, it is by working together that we will continue to keep people safe and well. Thank you very much for your comments. Now turn it over to my colleague.
Hi, it's Dr. Adams. I'm hoping you can hear me now. We just had a momentary blip in our connection. Excellent. So as of March 1st, 2022, over 1 million doses have been administered in First Nations, Inuit, and territorial communities. Over 88% of individuals aged 12 and older have received a second dose, and over 27% have received a third dose. Over 50% of children aged 5 to 11 have received at least one dose. As of March 2nd, there are 2,975 active cases in First Nations communities. And sadly, there have been a total of 664 fatalities with COVID-19 since the beginning of the pandemic. With a gradual decrease in vaccine effectiveness over time following a second dose, A booster dose is recommended to increase protection against infection and help reduce the risk of severe illness. Getting children up to date on their vaccinations is essential to their protection, given that some Indigenous communities have a younger population. Collective action in this area will help to protect the most vulnerable, those who cannot be vaccinated, and communities as a whole. Since the beginning of the pandemic, co-development and co-implementation have played a pivotal role in the successes we have seen in vaccine rollout and pandemic response in Indigenous communities. Co-planning at this stage remains critical as public health measures are being lifted across jurisdictions. Indigenous communities continue to face disproportionate risks of COVID-19 and require tailored approaches to public health measures. It is essential to support Indigenous-led strategies and approaches that reflect local context and unique needs of each community. I recognize that everyone is feeling fatigued, and we are all looking forward to a spring that brings us hope and a new energy. Imut, Nakmek, Marci, thank you, et merci.
We'll now start the question period. For those on the Zoom call, please use the raise hand button if you have a question. We'll leave you a few seconds. So we'll start with Emilia Fournier from APTN.
Hi, can you hear me okay?
Yes.
Emilia Fournier from APTN News. I was wondering if there is anything being done in the face of food insecurity with pandemic-related inflation, and now there's fuel prices skyrocketing with future sanctions imposed on Russia that'll increase the price of going out and getting country food as well and shipping food. What's being done to mitigate food insecurity up north right now?
Thank you very much, Amelia. And our officials are working on this issue as we speak with my colleague and counterparts. This is obviously something I'm keeping my eye on. We want to make sure that no matter what happens in terms of cost of living, that there is support for First Nations communities who obviously bear the brunt of those higher costs in a much more profound way. So we'll continue to do that work, and we'll come back to you with more actions as they evolve.
Thank you.
Do you have a follow-up? We'll now move to Toby Ng.
Hi, Mr. Hajdu. This is Toby Ng from the Canadian Press. I'm wondering, with the discovery of more potential unmarked graves this week, whether you're concerned at all that Canadians are becoming desensitized to this news and how you feel about that.
I'm not sure that Canadians are becoming desensitized to the news. I think Canadians, in many cases, are awakening to a tragic consequence of colonization that many people did not know. And I have to say, last summer on Canada Day, I was astounded by the number of Canadians that wore orange shirts with many versions of Every Child Matters that was prevalent in my community and across the country as a country mourned the loss of so many children. And I think that this is obviously a deeply, deeply traumatizing time for Indigenous people, many of whom are still, who are survivors, who are still carrying the scars of the residential schools and other atrocities inflicted on Indigenous people. But I think for Canadians that are non-Indigenous, many of them are just learning about this part of the formation of Canada for the first time and are stepping up to ask how they can help to be part of a healing process the country undoubtedly needs to go through.
Tobin, do you have a follow-up?
Yeah, Minister, so chiefs in Northern Ontario communities have called for stronger COVID-19 testing protocols for pilots, as well as more testing devices for airlines and airports that are flying into these communities. I'm wondering whether there are plans to prioritize test distribution for these pilots or other policies to kind of address these issues.
As I said earlier in my remarks, we're there to support remote and, really all Indigenous communities with the tools they believe will be essential to preventing further cases and fatalities to COVID-19. But I think I'll turn to my colleague, Patrick Boucher, or Dr. Adams to talk a little bit about what we're doing in regards to testing.
Absolutely. Maybe I could jump in and turn to Dr. Adams for any additions. So we've been working very closely with Transport Canada and colleagues there throughout this entire pandemic, obviously, to make sure that the restrictions that are being placed on various industries, whether it's the airline industry or others, are keeping pace with the pandemic as it evolves and has fluctuated over the months and years past. So that work will continue. There are obviously some pressure points in Northern Ontario communities that we're very attuned to, and that, as the minister said, we're working with those communities to make sure that we're addressing any of the concerns that they might have, including testing, making sure that we have the tests available. And at the end of the day, we've seen tremendous leadership from community leaders that have imposed their own restrictions in regards to people entering their communities. So we're going to continue to work in partnership with those communities to make sure that we're addressing their needs and their concerns. Anything you wanted to add, Dr. Adams?
Thank you very much. I agree that we meet regularly with community leaders, particularly in remote areas, so that we can hear their concerns. Like in the general public, there are some communities who wish to open up a bit more to mitigate some of the effects of closure that have occurred, and there are other communities who wish to remain safe. They don't wish to open their communities quite yet. And then there are others who are saying, well, if we're going to open, can you help us with particular measures, for instance, testing? And we're certainly there, and lack of access to testing is not an issue that we're hearing described.
A reminder to please use the raise hand button if you have a question. We'll go back to Emilia Fournier from APTN.
Hi, sorry about that. I couldn't hear when I was asked if I had a follow-up. I do have a follow-up. So the increased inflation due to the pandemic has been going on for a while, and it's been well documented that the effects on food prices up north have been pretty staggering. I'm wondering if there's no specific measures in place, what specific measures are going to be put in place, because it's been going on for a while for food insecurity.
Well, thank you very much, Amelia. And as you know, this is something that our government has been working on, and I'm working very closely with my colleague, Minister Vandal, on the escalating costs of price in northern communities, for example. As I said in my response, we are very well aware that Indigenous communities are particularly fraught with rising prices, and in particular, rising costs of fuel that will impact, obviously, costs of all kinds of freight going into the north. We are currently looking at solutions and supports that we can put into place to make sure that we can help First Nations communities and remote communities, northern communities, have what they need, whether it's fuel to heat their home or to get freight up to those communities.
Thank you.
Thank you. I can't see any other questions on the queue. So this concludes the press conference. Thank you very much.
Thank you very much, everyone.